numbers show more than 40% of Americans are lonely, many of them feeling that way on the job. And in the workplace, many employees and half of CEOs report feeling lonely in their roles. Joining us now with more is Dr. Romie. Dr. Romie, good to see you.
Good morning. Wonderful to be back.
This is so fascinating. Physician, you're a physician and brain expert.
Yes.
You're joining us here with Insight. How is loneliness dangerous for individual health as far as mental and physical well-being?
Yeah, Andrea, it's wonderful to be back. And people don't think about the loneliness factor, but it is the single largest health epidemic risk factor in the United States. And people are surprised, going, wait a minute, Dr. Romie, we always hear about losing weight or smoking cigarettes, but it turns out that loneliness in the United States is more dangerous than smoking 1 pack of cigarettes a day, for leading to health negative consequences like heart disease, depression, stroke.
So when we talk about the physical and mental aspects, those really play out like a number of different diseases. What about the impact on the workplace?
Yeah, Andrea, as I travel around the country speaking to Fortune 500 companies and meeting C-suite level executives, there are a couple of issues. Is that first, companies don't understand the negative impacts of bad employee health on the bottom line. Then we add loneliness into the factor, and what happens when an individual is lonely? Their frontal lobe of their brain gets hijacked, and that's that area that makes those important decisions of our brain, that we need to be productive at work and innovative at work. In a recently published article that's been widely circulated in Harvard Business Review, former Surgeon General Vivek Murthy looks at this, and there's reports that half of all C-suite level executives are actually lonely. And when you don't have a support system, it showed in poor job performance and in the bottom line.
And when it comes to bringing your A game, a lot of times people are bringing maybe a C or a D game if they're feeling these loneliness effects at work.
Because when the depression or the negative inflammation affects an increased risk of high blood pressure and heart attack, we can't perform well when we're not emotionally and physically feeling well.
Any other insight when it comes to lonely employees at work?
Lonely employees, so, you know, we can follow suit to some degree, like those innovative companies, Apple and Google. They create these workspaces where everybody is together. Right. But here's the problem. We're all in front of our phones and our computers all day. So we're not interacting. So talk to your employees about how to engage one another. What are activities that they would like to do? And then help bring together introverts and extroverts. So be mindful of the employees that may be less, social, a little bit more shy, and create activities where people will get to know one another. We spend more time on the job than we do with our families. And so to create a work environment that is healthy emotionally, socially, and physically only will help improve employee health and wellness and the bottom line.
Great advice, and maybe putting these phones down for a few seconds to meet your fellow employees would be a good call. Dr. Romie, great to see you. Where can people find you?
Find more information at drromie.com.
All right, Dr. Romie, once again, thank you so much.
Thank you.
Coming up